Newly released data from the Centers for Disease Control and Prevention reveals drug overdose deaths in the U.S. have dropped for the first time since 1990. Members of the Tennessee Department of Health numbers from the Department of Health show more than 1,800 Tennesseans died from drug overdoses in 2018. It was up from 2017. The United States Surgeon General joined local health and political leaders in a roundtable discussion about methods to combat the opioid epidemic. Febin Casahun reveals some of the focal points.
Sarah, as the number of overdose deaths continue to rise, they fear this will only get worse if they don't approach it differently. Today they discussed ending addiction in America and killing the stigma surrounding mental health issues.
United States Surgeon General Dr. Jerome Adams says in order to end addiction in America, we must learn to humanize people suffering from substance abuse disorders.
We need to help folks understand that addiction is a disease. It is not a moral failing. No one woke up this morning and said, I want to become addicted to heroin today.
Dr. Adams says stigma kills more people than heroin and cigarettes, and that substance abuse goes hand in hand with mental health.
The #1 mental health provider in the state of Tennessee is our jail system. We need to make sure we're providing the treatments in the places where people are.
If you have a mental health disorder, you get thrown out of the housing unit, you end up in the ER, you go back, you get thrown out, you end up in jail. Then you have nowhere to go but on the street. That's what's happening to people.
Congressman Phil Rowe says there's a shortage of psychiatric beds across the country.
We have less than 50,000 inpatient beds. We have nowhere, once we get to that point, to go treat anyone.
He says there's funding, but the state will have to step up.
The problem is we're paying it the wrong way. The bill's being paid now. We're just paying it on the incarcerated end and law enforcement end instead of the treatment and prevention end.
But the subject isn't all doom and gloom. Health officials have also seen progress in other areas, like the increase in life expectancy.
We've seen overall overdose rates start to go down for the first time in over 20 years.
We've seen a 43% reduction in prescribed morphine milligram equivalents. And for the first time, we think we may be the first state to see a year-over-year decrease in neonatal abstinence syndrome.
Now, Dr. Piercy added that dealing with adverse childhood experience is another way to combat the issue. There are many people who are self-medicating physical, mental, emotional, and spiritual pain.
Febin, thanks. The White House today commented on the decline in drug overdose deaths. In that statement, the director of the Office of National Drug Control Policy said, quote, while there are still far too many Americans dying from drug overdoses, today's historic news means fewer parents burying their children, fewer friends mourning the loss of their loved ones, and fewer communities hurting, end quote.